Hi everyone, welcome to another Art of Nursing interview. Today we're here with Rob Divers. He's the author of Magic Nurse Bedside Artist. He's also the book is a motivational guide to the benefits of combining art with nursing. How perfect. Rob's been a practicing nurse in the emergency room and pediatrics for 23 years. He has included in that practice therapeutic magic, comedy and music, and other modalities into clinical nursing. Rob started Magic Nurse in 2012 to educate and encourage the use of performance and performing arts in clinical environments, making bedside visits in local Dallas hospitals where he is. Traveling with Patch Adams on clown missions and working with medical clowns in Israel, he also discovered essential benefits combining therapeutic art with medicine. So this topic is perfect for the Art of Nursing program here today. And in this specific interview, we're going to talk about performing arts in nursing practice, using healing using humor, music, and magic. So Rob, welcome to the program.
Thank you, Elizabeth. It's so good to be with you.
I am excited for this topic. I have to tell you, I'm excited to hear about unique, creative, and fun strategies nurses can use wherever they are. So let's dive right in with why performing arts? You know, how did you start using this in your practice? What really inspired you to get into performance?
Well, since high school, I was always interested in theater. And once I grew up and realized that we all can't grow up and be movie stars and had to go get real jobs, we all go and get real jobs. But I always had that theatrical bug. I always felt that a job was kind of like being on stage. And especially as a nurse, we're always on stage. Everything that we do is being looked at by families, evaluated by patients, by staff, by administration. So literally, we are performing the role of a nurse, and we are being looked at just like an actor or an actress would be on the stage. And so using that premise, I started trying to figure out how we can do better in our nursing practice, by giving what's expected based on how we perform as a professional. So being a clinician in the emergency room, it's very, very serious. And obviously we have to take that job very seriously. But I experienced some burnout after 10 years in the emergency room. And then when I converted into working with pediatrics, I realized kids really needed to have some fun. And so I started experimenting with some of my old hobbies of comedy and magic with the pediatric patients, and realized that there's a lot we can do with art to enhance that nurse-patient relationship.
That's a really interesting perspective, that relevance to how we are sort of on performance as nurses. And I'm sure all the nurses tuning in would agree. We're always being watched and observed in our practice and evaluated. So let's talk specifically about what types of performing arts that you've used in your practice, maybe previously, currently. Let's hear about some of the performing arts types.
Well, when I first started doing magic tricks in the hospital where I work, I found that when you do anything that's slightly different than what is expected professionally, it creates a personal bond. It creates a friendly environment. So the patients don't expect a magic trick, or they don't expect to be able to see something have fun with their nurse. And so whenever I did a magic trick, and they're usually very small tricks that are in my pockets, I would carry about 5 or 6 different magic effects in my scrub pants, in my scrub shirt. And then whenever I would have the opportunity where a child was bored or scared or had anxiety, I would say, hey, would you like to see a magic trick? Oh yeah, I would. And so now that we've created something different that's outside of the medical expectation. And by doing that simple act of a performing art trick, it creates a friendly bond that now we've created a relationship where the feedback is instant. So I started with magic initially, and then the more I did, the more it snowballed and became something that my coworkers wanted me to do for their patients. Doctors would call me over and say, hey, will you do a trick for my kid? And it was just, everybody seemed to really need something outside of the expectation, have a little bit more fun, to take some of the edge off of the anxiety that's in clinical spaces. So magic is one of them. I carry, like I said, I carry several tricks with me, but really, in the hospital environment, you only need one. One good trick, one good gimmick, a handful of good jokes. If you know poetry, poetry is always fun. So it started with magic, then it got into music. And then when I discovered a thing called hospital clowning or medical clowns, that really intrigued me because these were the ones that were really living the Patch Adams idea. And I noticed that whenever I did a magic trick for a family, the family would say, "Oh, you're like Patch Adams. You're like Patch Adams," because they had no other frame of reference to say with this behavior that I just did. I did something fun as a clinician, and then all of a sudden I became like Patch Adams. So that was really intriguing to me. So I wrote Patch Adams a letter and I said, "Hey, I've been doing magic in the hospital, and the only phrase people can come up with what I'm doing is they use your name as say, hey, this is a descriptive for a behavior that they really enjoy and appreciate." And so that's how I became acquainted with Patch. I wrote him a letter. He wrote me right back and said, "Hey, you need to come on a clowning mission with me." And I said, "Great." And I know I'm rambling, but I want to get to this point. But I actually went to a clown school to learn how to be a clown so that I could be prepared to go on a trip with Patch Adams, which was completely unnecessary because all you really need to be a clown, and this is from Patch's own description. He goes, "If you put on a nose, you're a clown." So here we go. There's a nose. And so just by the simple act of putting on a nose, it changes the dynamic. You know, in America, we just had this thing a couple years back where Red Nose Day came to America. And everybody put on the red nose and everybody was having a lot of fun. I get a lot of mileage out of these little noses by putting them on patients, putting them on families, putting them on doctors, and it really changes the environment, rather quickly.
So what I'm hearing and what's interesting to me is it's having fun, doing something a little different, having that shift of expectation, and really using creativity, humor, or play, some kind of artistic style. Because I'm sure there are people in the listening and tuning in audience who are thinking, but I'm not going to become a clown. I don't know magic tricks. So let's talk about that. What if a nurse is sitting in this chair thinking to themselves, well, I don't have that kind of talent and I'm not into going out and getting a magic trick skill. What would you recommend nurses can do? I'm going to ask you more about the work with clowning, and we'll teach the audience some more about the programs and opportunities. But let's talk first, for people listening, what recommendations would you have for quote, quote, normal nurses who don't want to go out and become magicians?
Yeah. So art is such a wide range of things that you can do. If you have a singing voice, if you can sing, I've seen some great videos of nurses on YouTube where they sing to their patients, or where the nurses on the unit will get together and they'll dance. They'll do a dance number with the patient. So music or singing is another thing. Like I said, poetry or jokes. Look, if the best place to look is what do you enjoy as your hobby? Because what you want to do, why art works is whatever art works for you, that is something that is special to you. And when you craft your specific art, whether it be origami, whether it be crafts or painting. I had a nurse tell me one time, she read my book, she was inspired by it, and she painted a painting for one of her patients and gave it to her for their like 16th birthday. And it had such an impact that the nurse made a painting for their patient that it created a wonderful relationship or aura in that nurse-patient experience. So it's any art. I do something that's one of my favorites, and I like this so much that I make a little paper rose out of a square napkin. And you can do this with any square napkin, that's about, cocktail napkin size. And you can just, in the space of 1 minute, you can change that into a lovely little rose. See, like that.
Awesome.
So this is something that I teach and show that anybody can do this in the space of a minute. Now, when I make hospital visits, I do on the side when I'm not working, I make hospital visits and I visit people as a medical clown. And I say, hey, I brought you a dozen roses, but we're going to have to make them.
Mm.
So as a therapy for the patient, I'll bring in a stack of, a stack of roses, maybe 12 of them. And I'll say, here's a dozen roses, but you're going to have to make them. So I make one for them or their loved one. And then I show them how to make them. I say, give these to your favorite nurses and you watch how they'll treat you. So, and what that does is it gives the patient a hobby, something that they can do after you've left. That now they're making flowers and they're giving it to their doctors and giving it to their nurses. So you've used a little bit of what I call napkin roses as a origami skill that you can teach patients. So I use it for the patients and for staff. So, and what I use this in my work is I'll say, hey, you're the best patient I've had all day. I'm going to make you something special. Everybody who's in the hospital should get a flower, and this one's from your best nurse. And so just the act of making that flower in front of them and giving it to them, it's kind of like a magic trick, but it's not. It's just origami, and it's such an easy thing to do. But for the individuals, find what your art is, whatever you love the most. Bring some of what you love to work with you, because when you share that with your patient, now you're sharing something deep inside of you, your art, what you love, with the people that you love, the patients that you're caring for, and it just makes for a great relationship. Mm-hmm. That you get instant feedback.
And what I'm thinking too, as you're talking, Rob, is so for folks who may not work directly in patient care, but maybe over the telephone or in an office, removed and indirect hands-on. So they can do this maybe with each other, staff, professionally, and have hobby afternoon, or in a staff meeting, open it up with what kind of creative outlets do you use in your personal life and have a discussion related to this. So music, artistic, painting. I like jigsaw puzzles, so maybe I would bring a jigsaw puzzle to the workplace. All right. So you did mention medical clowns earlier, and I do want to touch upon that in case people are unaware or aware but curious and don't know much or want to find out more. What are medical clowns specifically, clown doctors, and their role in the hospital, and how did you tell us a little bit about your learning with that?
Mm-hmm. So it really goes back to the Patch Adams movie that came out in 1998. When Robin Williams put on a clown nose and started going around and being, Robin Williams in the hospital. He was, it was very funny. And people realized that they do want some of that. And that really inspired the profession, I think, of medical clowning. Now, clowns, the professional clowns have always kind of found their way into hospitals and have done a lot of charitable work. And that's originally how regular clowns got in the hospital. But the medical clown is something different. The medical clown is a parody character that's kind of a clown doctor. And so now we're sort of making fun of doctors, or we're the funny doctor that goes in and just puts everything upside down from the seriousness of the hospital. So the character itself in the presence of the medical world creates a quick escape into a playfulness, into a childhood type mentality. Everybody becomes a child when a clown nose gets put on their face. So medical clowns work in hospitals around the world. In Dallas, we had a great program called the Funniatrics at Children's Medical Center Dallas. They had a 12-year run of having 8 medical clowns that walked through the hospitals, and they visited patients on a regular basis in all the units: surgery, oncology. In Israel, they have probably one of the most successful programs called the Dream Doctor Project. And they have taken medical clowning to an academic level. You can get a bachelor's and now a doctorate degree in medical clowning. And what they've done is they've combined some nursing type courses with performing arts courses, and have created a medically minded performer who dresses as a clown doctor and does work in hospitals, relieving anxiety, helping patients or children especially get through painful procedures using distraction. And they're very valued by the medical staff. So they really work well with the medical staff to kind of help kids get through their issues. They even did a published study where they compared the use of Versed for preoperative anxiolytic with the use of a clown. And they found that the results were exactly the same. The kids did not have to go through the experience of, having the hangover after coming out of anesthesia from the Versed. But so they're finding that it's a good paraprofession in the hospital. There are paid programs throughout the country. They're not as prevalent in the United States as they are in other countries. I believe it was Venezuela actually came up with a law that all children's hospitals had to have medical clowns working there because they really appreciated the value of the medical clown role. So,
wow, that's fascinating that that research article and the study published. So you mentioned, and I want to touch back on that just for the audience sake and making sure to really note this, performing arts and how it affects the patient. So you mentioned distraction, pain alleviation. What else in the nurse-patient relationship, or just the patient themselves, by having humor, by having music, magic, whatever art may have you, what kind of, if you mentioned some we've already spoke on, that's fine. I just want to bring this point home to the audience. But what are the benefits really then that are published, you've seen, you've experienced for patients?
Well, specifically in the world of magic, I think any of the arts that we bring to work and then we use them to share as an empowerment tool, becomes therapeutic for your patient. And really you have to assess whether the patient is, likes magic or likes music or likes content. And if they like one of these things, now if you share some of that art with them, something that they can do. Like when you bring the roses in, the napkin roses, now I'm teaching them a skill. Now I've given them a skill which empowers them. Another great thing, there's a program, and I wanted to talk about it a little bit. There's a program called the Healing of Magic. And it's just a little booklet right here, Healing of Magic. It's written by Kevin and Cindy Spencer. They actually have worked with occupational therapists, and they use the teaching of magic to patients in an occupational healthcare setting where they can work. The teaching of magic gives them work on fine motor skills. They have developed the use of magic or teaching magic to patients gives them something that empowers them. It's a motivating factor. They would rather do therapy that seems to be fun rather than doing therapy that seems to be grueling and boring. So by turning some of these fine motor magic tricks, and they actually have what benefit of these of these tricks do as far as pronation, supination of the hand, opening and closing of the hand. There's a very simple one, and I'll show you. I'll demonstrate this real quick with a simple rubber band. I'm gonna put this rubber band. I don't know if you can see it.
Yep.
Okay, I got this rubber band on these two fingers. I'm gonna magically make it jump to the other two. Watch. Ta-da.
Wow.
Okay, so now it doesn't seem like much, but what we've done here is we've opened and closed a hand, and that might be what the therapy is. And by turning it into a magic trick, and I'll make it go back. Now it's back. Wow. So by turning it into a magic trick, a simple rubber band becomes a tool to teach magic. And for the patient who's having difficulty working on this hand, well, now that's a new motivator.
Wow.
So that's one of the uses of magic. Kevin and Cindy Spencer have a great program. It's called The Healing of Magic. But David Copperfield himself, I'm going to show you this book right here. This is David Copperfield's book. It's called Project Magic. You may not be able to see it. But Project Magic was something that even David Copperfield saw a huge benefit in teaching specific magic tricks for their therapeutic benefit. Now that's in the world of magic. In the world of music, we already know that there are music therapists that work in hospital settings. They're now paid professionals that come in music, and they teach their patients and give them the tools to do music. They'll play ukulele or play a keyboard. So they're using the art of music also is already established as a therapeutic modality. In the world of clowning, and I saw this at work in a Lynn Hospital in Jerusalem, which is a rehabilitation hospital where kids do a lot of physical therapy. And there they used the clown is actually assigned to the therapy room to work with the physical therapist to create a fun game, a clown game, with their patients to make the therapy fun. When I was in Israel, I worked with a 6-year-old Russian girl who was in full body braces, and her role was to walk across the room with her walker. And the way we made that happen is we played a telephone game. Like I would step out in the clown character, I would step a few feet ahead of her and I had a banana, and I would make it ring, ring, ring. She didn't speak English and I didn't speak Russian. So, in using just clown language and clown and expression, ring, 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 telephone, oh, it's for you. And then she'd come over and she'd answer the phone, and then I would reward her with a colorful scarf. So making games as a clown is just a playful way. So that's using comedy and clowning in a therapeutic way. That's the best use I saw in making games that make the therapy fun for the patients.
That's excellent. I was thinking when you were speaking about that, I don't personally work with patients, but I do have, colleagues in an office, and we do have retreats or staff meetings or times we get away to do professional development and team building. So even in that capacity, which is what I want to ask you about next, how has your coworkers and, leadership and management responded to this bedside approach of bringing humor, music, play to patient care?
Well, it's interesting. When I make a hospital visit to like an adult, I've been to many adult hospitals as a visitor. And when I go in, the staff doesn't know that a clown is showing up on their unit. So, and they're just as excited and interested to see, oh, what is this coming in our unit? Because they didn't know specifically that I was coming. When I go visit a patient, it's by specific request. So I've been requested to go see a specific patient at a specific time, and that's how I get into hospitals. One of the favorite tools that I use, and I'm going to show you this now. I've brought all my toys so I can show you. For team building especially, there's nothing better than the world's biggest, giantest underpants. Okay, I can't tell you how many times I've gotten most of the unit on a floor, the staff, to jump in these giant underpants with me and parade around the unit for their patients. I learned this from Patch himself. He uses big giant underpants. It's a prop. It's a clown prop. I don't know if I should open this up and show you, but trust me. As you can see, there's 3 people. You could fit 3 people, and Patches fit as many as 5 or 6. And there's nothing more team building than all jumping in your big giant underpants together and being silly on a unit. It only lasts a minute. It's really fun. The cell phones come out. Everybody takes pictures of the big, and then it's just kind of a fun escape. It sort of releases a pressure. It's like a pressure valve. It takes a lot of the pressure off. An unexpected moment. Nobody expects to see big giant underpants, but when I pull that out of my bag, say, "Hey, let's all get in." It's kind of like a sack race, except better. So there's some of that. And any of these things, it's about creating a happier environment in the workplace. We all tend to take ourselves very seriously in our work, and we have serious jobs, and it's really important that we know when to turn it on and when to turn it off. That's the key, and that takes a medical mind really to know when is a good time for comedy, when is a good time to interject a little bit of something special. And nurses are very intuitive, and they kind of know, oh, this is the right time for this, or this is the right time for that. Timing is really important, not only in comedy, as many comedians have said, but knowing what's needed to take it to the next level to make something special for a patient. Because it's about the relationship. And these are just gimmicks. I mean, you can use anything that you enjoy, that is fun for you, sharing it. A lot of people bake cookies and bring them to work, and everybody is happy when those cookies show up. So that act in itself is the art. I think giving is an art, and whenever we can give something that is important to us, that we value, we're showing other people that they're valued as well. And it takes down the anxiety level, the stress level, when we're all really appreciating each other as people, we're connecting as humans. And I think in the nurse-patient relationship, that's where all these tricks work, is creating that space where you're a human. I value you enough to share something that's not really required of my job. And just because I value you as a person. And then they start to look at you as a human being, not just the nurse that's going to show up with their, their medications when on time. But it really helps for those human relationships that we have.
Excellent. Great point. So we have time for maybe just one more question. And I don't think I've heard you talk about this yet. So what is the AATH, the Association for Applied Therapeutic Humor, and how is that being used in medical settings?
Mm-hmm. Yeah, the AATH, shortly after I wrote the book, a lot of people from the organization really started reaching out to me, and they said, hey, have you heard about us? And I looked into them, and they're really great. So if it's a great organization, they actually have a certification course that you can take up to 3 years, and you can actually be certified as I think they call it a certified humor professional. But basically they use therapeutic humor, finding ways to bring laughter, comedy into those clinical spaces. They feel like that one of their mission statements says that any intervention that provides health and wellness by stimulating playful discovery, expression, or appreciation of absurdity is what their goal is. And they have a website, I believe it's aath.org. So anybody can join them and start, and they have a lot of resources to what you can use to bring comedy, and how it's useful, where it's useful, and you can actually get a certification in it. So, once I discovered for myself, for my own personal satisfaction of using the arts, I'm finding, well, it's not just a thing for me. I guess this is really out there in the world, and there are places you can go that you can learn things. Laughter yoga. Have you ever heard of laughter yoga?
Mm-hmm.
Okay, I think the first time I experienced laughter yoga was at a clown convention, and somebody said, "Oh, let's experience this," and I thought it was the stupidest thing in the world at the beginning. And then, but once you started laughing, you couldn't stop. And everybody in the room who was really embarrassed and didn't want to do it now was doing it, and now it was really, really fun. And now we're like, oh, really glad that we did it. So it's that's another skill. Laughter yoga is a thing. But AATH is a great organization for anybody who wants to go and learn more and find resources about using humor as a therapy.
So before we close, I just want to point out what you mentioned just a moment ago, Rob, in terms of a lot of these practices, these modalities, using the arts in work. The underlying reason you started out, which you talked about at the beginning, was because of your own personal burnout. Mm-hmm. And so as the audience members are listening today, this can be a self-care modality. This can be a resilience strategy using art, figuring out, as you talked about earlier, Rob, what are your creativities? What are your hobbies? How do you play outside of work? So this is self-care, and then bring it to work, whether it's with your staff or with your patients, whatever you bring your artistic talents. So it begins self-care, and then it kind of ripples out to other people. Is that right?
That's exactly right. I didn't have any of these skills when I started. I had a small hobby of where I did magic tricks. And when I realized this was really a thing, then I found the Dallas Magic Club. I found a magic club, and I joined a magic club, and I found a magic teacher, and I spent like several years learning magic, because that was like, oh wow, I really love this. So you can find, even if you don't have skill now, what are you interested in? Because there's an organization or a group. Clowns, they have clown alleys. You can join a clown alley. They'll teach you everything you need to know. Clown college is 1 week. There's several clown colleges you can go to. I've got them listed in my book. But you can the clown college, anybody can go learn how to be a clown in a week. And then you're going to have that skill. Music, I sing with the Vocal Majority Chorus. It's a barbershop harmony chorus here in Dallas. I joined them in 2010. And by joining that chorus, now I've learned I'm bringing more music into my life. So whatever it is that even if you weren't good at it, my goodness, go find what it is that you love. Even if you're a singer but you don't think you sing good, go join a barbershop chorus. You're gonna work those muscles, learn how to sing, and you're gonna learn how to do it, and you're gonna love it. And then you can do that. The ukulele. Did I show you my ukulele? Okay, here's my ukulele. I bring this to work with me. I strap it on. It's on me all the time. Now, I don't pick it out and I play it for everybody, but if somebody says, hey, do you play that? Oh, yeah, I sure do. And then that's an invitation. By them seeing this ukulele, which is made out of plastic, it's made by Outdoor Ukulele. They're a great company in Oregon. And you can sterilize the whole thing. But I use this. This is an icebreaker. People see it. They say, hey, do you play me a song? And then I'll play them a song, There we go. Here's the musical interlude to the ending of this interview. Okay, so that's the ukulele. Now, you can learn to play ukulele. It's very easy. It's an inexpensive instrument, and there's a great website called druke.com. He's got 1,600 songs on there you can learn. Every ukulele song I ever learned I took off that website. So you go find what it is that you love, go find where you can learn about it, and let that be your own hobby for you. Once you find your happy place, nothing makes it. I drive with this in rush hour traffic. It's a perfect cure for road rage. So let me get it out of the way here. Oh, I'm tangled. But it's find the art that makes you happy, and then once you find your happy place with it, and you're like, then go share it with somebody. Share it with your coworkers, share it with your patients. It just makes you a happier person. But yeah, I was burnt out until I fixed it.
Excellent. Well, Rob, thank you so much for your time, for your experience, for your expertise, and sharing all these resources with us. We appreciate you being part of this program. And again, thank you.
Oh, my pleasure. It's great to be with you, Elizabeth.